So we've heard that you have a reputation on your gallbladder surgeries. Could you go ahead and just give us a little insight on how that goes down there?
Yes, I love the gallbladder. I feel that it is very underestimated and was it the underestimated organ. I think that I find so often that people have chronic abdominal pain and they have their gallbladder is just neglected in their workup, and that's a common cause of upper abdominal pain, right? Or even a lot of times people think they're having a heart attack and have you know near chest pain, and end up in the hospital for a heart attack like symptoms. It ends up being their gallbladder. It also causes pain, typically in the right flank and right back, midline in the back, very seldomly in the left upper quadrant. But people tell me all the time that they think they have lactose intolerance or something. It ends up being their gallbladder, and they, because they're eating a cheesy thing, and then it stimulates their gallbladder to do its thing, to squeeze, and then they shake up the rocks in there, and it causes pain all the time. Typically, a lot of times people have stones in their gallbladder, and their doctor says, "Oh, just don't worry about it." But the thing is, those stones in there are like those lotto balls. And they pop up, and then the number for the day pops up. That's what those stones, they pop up and they block the ducts. This is a gallbladder fluffy here. And so typically the stones might be like this eyeball here, and they pop up, the gallbladder squeezes, pops up, and gets stuck in this gallbladder neck. And the gallbladder is trying to squeeze against this obstruction, and that's causing so much pain. People just belittle it for forever. And every time you're having pain, you're causing inflammation, and inflammation causes scarring and wall thickening. And these structures start to stick together, and that's how your surgery gets more and more difficult every time you have pain that you just ignore. So I don't recommend that pretty much anybody with gallstones should keep it in unless under some very extreme circumstances, and because of the symptoms that it can cause. There's also a small association of the stones with cancer. You get pancreatitis as they go down this duct, and the pancreas is right here, and get inflammation and bad infection of the gallbladder. Here in Vegas, we see people that end up at the casino, go to the buffet, bam, they're in the emergency room. Happens all the time. And so I recommend really, if you're having abdominal pain, you got a gallbladder, at least getting an ultrasound and seeing if you have any stones. And there are other things that can also be done to refer the workup of biliary symptoms. So I appreciate the gallbladder, and I think that is neglected, and it's like a little gremlin, I think, biting people's backs. I love doing gallbladder surgeries as one of my I think God put me on earth to remove gallbladders, and to do it well. I think that our technique, typically I can do it with 3 incisions. Most people will say 4, but I can do it typically with 3. And we can also do it with the robot, which also allows me to do it with incisions, which I can hide, and for a better cosmetic result, if desired. And so I think that that's a great technique I can offer patients. Typically after other symptoms of having gallbladder problems are irregular stools. Constipation or loose stools can both be a symptom of that bile not getting through that duct and lubricating your intestines, basically. And so irregular bowel habits, and that's about it. There are risks of any surgery, which include bleeding or infection or damage to other structures. Those are very, very unlikely things to happen. We have to tell you about that. We have to also watch out for these ducts, these other ducts. Those are one to be damaged, and so you may, if that were to happen, you have many more surgeries. But that's tremendously unlikely. But still, I can't even. I don't know. I can just ramble on forever about gallbladders, and I don't want to put a video. And I always got to tell risks and benefits as a surgeon. So that's how our consults typically go. Tell you everything. And but yeah, typically after a gallbladder surgery, just no heavy lifting for a couple of weeks, depending on what you do. But no, I tell people don't go to the gym, lift large objects, but you can do aerobic exercises within a week or so. But no heavy lifting for about 6 weeks optimally, and then after that you can really do whatever. If you have a desk job, you get back to your desk job typically after a long weekend. And if you do construction, you might want to wait a couple more weeks than that. But that's what I do, and I love gallbladders.